Understanding respiratory disorders and related medications. A quick overview. Welcome to our comprehensive guide on respiratory disorders and their treatments. Today, we'll explore the fascinating world of respiratory medicine, breaking down complex concepts into understandable pieces. We'll cover 5 essential topics that will help you understand how these conditions affect the body and how various medications work to treat them.
Let's start with asthma, a condition affecting millions worldwide. Imagine your airways as tubes that carry air to and from your lungs. In asthma, these airways become hypersensitive to certain triggers, leading to 3 main changes. First, the muscles around these airways tighten, causing bronchospasm. Think of it like squeezing a straw. It becomes harder for air to flow through. Second, the lining of these airways becomes inflamed and swollen. This inflammation is driven by immune cells, particularly T helper 2 cells and eosinophils. Finally, excess mucus is produced, further blocking the airways. This triple threat of muscle tightening, inflammation, and mucus production creates the classic asthma symptoms of wheezing, coughing, and shortness of breath. Moving on to COPD, or chronic obstructive pulmonary disease. Unlike asthma, COPD causes permanent changes to your lungs through 2 main mechanisms. In chronic bronchitis, constant irritation leads to ongoing inflammation and excessive mucus production in the airways. The airways become permanently narrowed and scarred. In emphysema, the tiny air sacs in your lungs, called alveoli, become damaged and lose their elasticity. Imagine a balloon that's been stretched too many times. It loses its ability to bounce back. This makes it harder to exhale air completely. Now let's look at bronchodilators, the first line of defense against airway obstruction. These medications work like keys, unlocking tight airways. Beta-2 agonists like salbutamol quickly relax airway muscles. They're often called rescue inhalers because they provide rapid relief. Muscarinic antagonists like tiotropium work differently, blocking signals that cause airway tightening. They're particularly effective in COPD. These medications can be short-acting for quick relief or long-acting for maintenance therapy. Anti-inflammatory medications, particularly corticosteroids, target the underlying inflammation in respiratory disorders. Inhaled corticosteroids like fluticasone work directly in the airways, reducing inflammation by suppressing multiple inflammatory pathways. They're like firefighters, putting out the inflammatory fire that causes airway damage. These medications are crucial for long-term control, especially in asthma. They reduce swelling, decrease mucus production, and help prevent future attacks. Finally, let's discuss antihistamines. These medications block histamine, a chemical that triggers allergy symptoms. While they're not primary treatments for asthma or COPD, they play an important role in managing allergic triggers that can worsen respiratory conditions. Modern second-generation antihistamines like loratadine provide relief without the sedation commonly associated with older antihistamines.
Understanding these conditions and their treatments helps us appreciate the complexity of respiratory medicine and the importance of proper medication use. Thank you for watching. And don't forget to consult learning resources for specific details about these disorders and related medications.